Let's finish off by having some clinical considerations of cartilage and bone diseases. There's a list of some diseases that we will discuss, but obviously, as you can imagine, this is not an exhaustive list, and some of them will be covered in other areas by other faculty. So osteoarthritis is really a disease of the joint which involves both bone and cartilage here. Cartilage represented as green, bone as yellow. In addition, there's a whole load of other soft tissues involved in the disease. We don't have the time to go into it, except that this disease is considered disease of the joint rather than really disease of the cartilage. But nonetheless, if you look at the left-hand side here, this is the normal features of the joint, and then this is what you expect to see in a progressive osteoarthritic state. So here the cartilage is affected, where you are losing cartilage and this joint space narrowing, becoming smaller. The capsule, the synovium here, is thickening up. The capsule is thickening due to inflammation in the joint, as well as there are some bony cysts that form. So overall, as you can appreciate, this joint here is very different to what you would expect to see in a normal situation. Osteoporosis is a disease of the bone itself, where there is a loss of bone structure or increase in porosity. So thinning of bone due to loss of that bone mass, and this particular disease causes structural damage, which leads to fractures. It's age-related, but there are other pathological situations due to lack of estrogen or vitamin D, calcium, as well as PTH is involved. There are multiple other reasons which you will learn later on. But the net result is that there is a loss in bone mass and bone structure, which leads to weakening of the bone, thus increasing the risk of fracture. Paget's disease is a disease where there is excessive bone turnover. So both the osteoclast and the osteoblast are working over time. Because the osteoblasts don't have time to catch up with the osteoclastic resorption, whatever the bone that is forming is immature, and if you remember, we refer to that as woven bone. So that in itself is making the bone weaker. How it's formed, we don't know, but there is a clear change in structural properties of the bone itself. Histologically, you can see that clearly there is lots and lots of new bone that's been formed by these lining osteoblasts, as well as the presence of these large osteoclasts. So you can see this whole image is depicting a status where there's a continuous turnover of bone, as is the characteristic hallmark of Paget's disease. Osteomalacia, also known as the Ricketts disease, is where there's an abnormal mineralization of the bone. So in this picture here, you see the green picture or green stain here is for the mineralized tissue, and then the red here is depicting the unmineralized osteoid. So overall, because of the lack of mineral in these areas, is making the bone softer. So it's referred to as a soft bone disease. On the other side, there's a disease called Osteopetrosis, where there is more mineralization than you would expect in a normal bone, which leads to bones being very dense. And you can see that in this image, which is a radiograph, and the density of bone is much higher, attenuating the X-ray signal. So more mineral does not necessarily means that there is a stronger bone. In fact, the mineral that is present in there is structurally incompetent, and so the bone's fracture and the shape of the bone is severely affected, as is apparent in this image. Another disease that you should be aware of is referred to as osteogenesis imperfecta, or brittle bone disease. This is normally a disorder of type 1 collagen. So there's a structural issue with the extracellular matrix, which leads to structural failures and multiple fractures. There are multiple types of OI. They can change from very mild, which are not affecting quality of life, to lethal, which can be in utero lethal or soon after birth. You can see fractures here in this newborn child. There are fractures here, 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 and in this case you can see this clearly a fracture right across here. It's a genetic mutation, genetic disease, mutation of type 1 collagen. So something that you would probably hear about later. So to summarize what we have discussed, we discussed the different types of extracellular matrices of cartilage and the cellular characteristics within. We looked at the bone and cartilage differences and the types of bone cells that there are, types of bones, and structure of bone at the macro and micro level. We also discussed bone formation, growth, and repair. And we looked at longitudinal bone growth at the epiphyseal growth plate and how it is seen in clearly demarcated 5 different zones within the growth plate. We also described some common diseases which are associated with cartilage and bone.